Currently, many studies are looking at the combination of BTK-VEN combinations with and without obinutuzumab for patients with CLL. One of the questions which get asked is that if you're using your best drugs up front, what will happen at the time of relapse? So in this particular study, which was the data from the CAPTIVATE study, we looked at patients with the CAPTIVATE study who got 1 year of ibrutinib plus venetoclax, and then they subsequently stopped therapy and then they had a relapse. When the patients relapsed down the line, they were not on any therapy. And when we looked at the sequencing of these patients for mutations for resistance to both ibrutinib and venetoclax, namely BTK mutation, PLC gamma 2 mutation, and BCL2 mutation, none of these patients had a resistance mutation. So which means the disease is still sensitive to the drugs they received a few years ago, namely ibrutinib and venetoclax in this case. And these patients were then retreated, some of these patients, with ibrutinib or ibrutinib plus venetoclax, and they all re-responded. So I think this paper really highlights the point that when you use a time-limited approach and the patients then progress in the off-therapy phase, they still remain sensitive to the drugs they have used previously, and they do not have any acquired resistance mutations. So I think this is an important question which gets asked, but I think this paper really answers that question, and it kind of makes a way to use time-limited approaches for our patients and not to worry about resistance down the line, and you can reuse the drugs again.